Interpretation gets a lot of attention because of how dramatic some of these interpretations have been depicted in movies, and also how inaccurate some of these interpretations can be. So a stereotypical interpretation could be, you get yourself in these relationships with emotionally unavailable partners because you're afraid of long-term commitment. You know, when it comes to interpretation, none of these interpretations should be taken as face value or absolute. In general, I would say anything that a therapist shares in a session should be up for debate and discussion. This is kind of what makes therapy interesting, is that we're hypothesis testing. We're testing hypothesis, and we have our subject in front of us to be able to refute the evidence and to be able to wonder about, why things are and why things may not be. When I think about using these interpretations, I don't mean to use them as declarative statements of trying to explain everything and anything of how a person is. I would also say that how therapists use interpretations is also a measure of a therapist's skill and experience in being able to implement this in their therapy sessions. If I think about how I would issue a gentler and kinder interpretation in a hypothetical therapy session, I would probably layer the statements gradually and ease in this interpretation, and I would want to be able to share these interpretations more as questions rather than declarations. So, for example, being able to kind of set the stage by asking the person, do you think that your latest relationship ended in a similar fashion as your previous one? And being able to tell real time whether or not the person is able to see the pattern. Because if they're not able to see the pattern, there's no point in going down this particular route of hypothesis testing. It could be in the future, but not at that time. If they do understand that there's a potential linkage there, then I would just continue on and layer on the interpretation. These men that you've dated, they all seem emotionally distant. Do you think that there's a connection here? And really continuing to assess their level of understanding of whether or not there is a pattern that they notice. Again, these interpretations are not the end-all be-all of therapy, and the goal of a psychodynamic therapy is not to share all of these interpretations and quote-unquote figure somebody out completely.